Hi everyone, we're here on our part 5 discussion on PRP with Dr. Moheimani. Go ahead, doctor, and continue your talk.
Right. So we were discussing previously that there's only a few number of case reports, which is a small sample size, n equals 1, meaning one patient they looked at. This is the only study that had multiple patients enrolled to look at how they did for a meniscus injury. And the way I found this paper, I use these search terms. Finding medical literature consists of, searching certain words and trying to find uh, what comes up. And after looking through many articles, this is the only one I could find that was pre-surgery with multiple patients that had a meniscal injury and got a PRP injection.
Okay. Do you want me to go ahead and move on to the next slide?
Yeah, sure.
Okay, introduction.
So basically, what we need to know is that the larger studies using PRP are actually related to the orthopedic surgeon doing PRP intraoperatively, meaning like you're getting the surgery and they inject the PRP during the surgery, which is very interesting. I think that there are favorable results for using PRP in surgery. I don't doubt that application, but I wanted to look at a study that's before we go to surgery. How does PRP work? And in this paper that I'm talking about right now, they basically thought that with grade 2 lesions of the meniscus, they did a PRP injection and then followed them for 6 months to see if there's any improvement with MRI. And they assumed that people would get better and that their MRI scan would improve as well.
Okay.
And then moving along to the methods section.
Okay.
So the sample size is n equals 10. So 10 healthy athletes, they had 6 months or more of pain. They had tried conservative management. So that's physical therapy, that's using your Aleve, your ibuprofen, icing it, resting it. And they kind of excluded the serious medical conditions. So like they didn't have surgery and they weren't diabetic. They're relatively healthy. They use this particular Arthrex ACP double syringe system and they centrifuge the samples. It's kind of going back to the slide showing the PRP in our previous talk, how they do the PRP. And they actually did the injections under fluoroscopy, which means they take you to a suite, a radiology suite, and they shoot you with x-ray to make sure the needle's in the right place. And then they had the patients rest for 4 weeks, and then they looked at their MRIs 6 months later, and they kind of saw how the patients were doing. So if we go to the next slide.
Okay.
The results. So the arrows that I drew, they're kind of light blue. They're kind of a little bit on the harder side to see. But essentially, there were 4 patients that they didn't really have much improvement to the PRP injection. But the other 6 all did significantly better with a P of 0.027. In the medical field, this p-value is very important and what we consider to be significant, which is a whole lecture in of its own. But basically, we saw significant improvement in 6 out of the 10 patients. And the cool thing is that it even noted that there was improvement in the lesion, meaning like the grade of meniscal tear, like the grade 1, 2, 3. Some of the patients actually improved from like a grade 2 to a grade 1, which was kind of exciting as well.
Okay. But, for me being the MBA or the business person in the family, if you told me I have to spend $2,000 on PRP injections and there's a 60% chance it will work, I don't know if I'd pay $2,000. I think the price would have to come down significantly if that's, and is that the normal, in your experience, is it normally, for me it was 100%. Everything I've used it for, it's been 100% success, but would you say that there is like maybe a 60-70% chance it works and then there will be maybe 20, 30, 40% that it won't work, the injections won't show any kind of improvement?
That's a very complicated question because in science, you can't really estimate with such a small sample size. This is 10 patients. So before I could tell you that this injection works 60% of the time, you would need a lot more patients to say that.
How many? Like 1,000, 2,000? And why hasn't there?
It depends. That's actually, again, a very complicated question. So my overall consensus from this is that there were patients that benefited. So sure, PRP doesn't work all the time. And you're right, $2,000 is a lot of money. But also, if you think about it, these patients had chronic pain for 6 months. And the fact that they didn't have to go to get surgery is kind of exciting, because surgery, there are patients who are not happy after their meniscal surgeries. And there has to be more studies kind of comparing the two, which has not been done. But I mean, I would much rather have an injection than a surgery, because every time you do a surgery, there's a lot more risk than doing a PRP injection.
And all these pro athletes are doing it, so you would assume if all these pro athletes are doing it, I mean, it has to be somewhat. I mean, I hate to be saying monkey see, monkey do, and there's not enough science, but I mean, if professional athletes are getting a procedure done, wouldn't you say that's a good sign? I mean, you wouldn't hear about these pro athletes doing it if it wasn't working, right?
I mean, yeah, you could use that as a logic. In the scientific field, we would say that's not enough evidence, but I think for the average person, if I see Kobe Bryant or Lonzo Ball getting it done, then that would make me much more incentivized, because they take this very seriously, and they would not be putting themselves at risk unless it was worth it.
Exactly, and they can easily afford $2,000. But can we go ahead and move on to the next slide?
Yeah. So the next slide just shows that there was a patient that. Without getting into the very nitty-gritty of MRI anatomy and imaging, which again is a talk of its own, there was improvement in the way the MRI was read. So basically, they went from having a much more serious injury, or not, well, I wouldn't say injury, but the read was much more intense, and then it looked like it kind of resolved after the injection, which was reassuring.
Okay. And can I go ahead and move on to the next slide?
Sure. So the last part of the talk is basically what our discussion is. And so we have to keep in mind, so 60% of the patients were very happy, returned to sports activity. Again, this is a small sample size. 10 is usually a pretty small study. And then you have to keep in mind, this is a very specific utilization of PRP. So just because this study, only 6 patients got better, you cannot necessarily extend that to using PRP for, let's say, an ACL injury or your, golfer's elbow or tennis elbow. Every part is very specific. So you want to make sure that it kind of lines up to whatever injury you have. And then the improvement that they did see, the reason the authors felt like PRP helped them is that it helps with when you inject the platelet-rich plasma, the platelets themselves, they have inflammatory and different, what we call cytokines, which are kind of act like hormones, and all these different factors kind of induce healing. There's some really fancy words like fibroblastic growth factor, insulin-like growth factor. So again, that would be a talk in itself, discussing all the different biologic mechanisms. But they've basically mimicked this idea of these different substances, and you see in animals when they do research that you can draw these like growth factor levels, and they'll increase with the usage of PRP, which kind of is the idea of how it causes healing.
So should we finish? We're at the 8-minute mark. Should we finish, or should we start a new video?
We can go ahead and just finish the talk. There's not much left.
Okay, cool. So on to the next slide.
So the limitations of this study is, so they wanted to make sure that the PRP was placed in the right place. So there's growing discussion on whether ultrasound versus fluoroscopy, which is like the X-ray imaging, is better. This study was done under fluoroscopy, and I would argue that ultrasound makes more sense. So that's something that you should think about. Like they'll usually use an ultrasound to make sure they're going in the right place. Keep in mind there's no control group in this study, so they didn't compare them to just like rest or if they'd gotten a steroid injection. But I can tell you that for steroid injections, steroids are known to be chondrotoxic, chondro meaning cartilage. So keep that in mind. The good thing about PRP, it does not eat the cartilage away like a steroid injection would. So that's why you should really consider PRP if you're a young, healthy person. Even if you're not, trying to preserve whatever cartilage you have left.
So stay away from those And don't you think in the future, once again, I don't want to get you in trouble, but I mean, won't they get rid of cortisone? Isn't it just like an old bad thing that they have that maybe in 10 or 15 years no one will do anymore?
Yeah, so that's a great point, and I've often thought about myself that eventually maybe steroids will become very, very limited in what they're used for. There are certain disease pathologies that steroids make a lot of sense, but I do think that steroid injections for the knee over time is really going to fall out.
So guys, if you guys are listening to that, stay away from those or look at other alternatives, right, doctor?
And that's what PRP is, an
Okay.
alternative to steroid injections.
Okay. Move on to the next slide, or is that the last slide?
Yeah, let's move on to the next slide.
Okay.
Um, so just some shortcomings for this study is, right, the sample size is small. So you really can't draw all the conclusions from the study, but it is reassuring. I mean, some patients did get better, but keep in mind this is for healthy athletes, so it is a certain population type. And with that same thing, you can't really know if the athletes were compliant with the rest protocol, because some athletes you can't keep them away from activity. So maybe the patients who didn't get better, they were exercising. And the lesions in the MRI got better, like the MRIs look better in certain patients, but I can't tell you with certainty that, like, I may have these lesions on my MRI and I might not have any. So MRI is a little complicated. What you see isn't always what's going on. And again, the stats of this paper, with the small sample size, kind of makes things a little complicated.
Okay.
So to summarize, though, if you go to the next slide, when you do go to your doctor, if you're going to get PRP, they're going to hopefully use an ultrasound. And this slide just kind of shows the ultrasound technique so that they can make sure they're actually injecting right into the right part of the meniscus.
And hold on really quick, I want to come into this. If you guys watch this channel, I actually have gone on to do my PRP, and we actually have video of my dad using the ultrasound, and he actually shows, I don't know if you've had a chance to do it, but these videos that you're showing is exactly, so if you guys have a chance and you haven't gone through this channel, click on some of the videos where I'm getting my PRP injections, and you'll actually see this whole process of my dad using the ultrasound, and he'll actually point out the tear that I had in my elbow, and you can see everything. It's really amazing. And
so real quick, you can kind of see the different approaches and how they inject it, and then how they can make sure they get it into the meniscus, like right there where it needs to be.
Move on to the next slide.
Yeah, so I mean, that's kind of the end of the talk. Really, the future is getting bigger sample sizes of these injections, so that we can feel even more confident about doing these injections. But again, we're in the infantile state, and there's a lot of promise of what these injections can do. And then the last slide is just my citation, so that kind of concludes the talk.
Okay, cool. And if we are going to do the question stuff like that, we'll just do it on another slide because we just hit 13 minutes. So we should have broken up into a part 6. But thank you for your time. Thank you for providing this discussion. And I think I have some questions for you, but I'll go ahead and ask you those questions on another video. So thank you very much for watching, guys, and we will both talk to you guys soon.